Hi, I just wanted to take this opportunity to discuss a topic that I think will be really important to a lot of folks out there, and that's a treatment for joint pain or musculoskeletal injuries. Now, the treatment I want to talk to you about today is platelet rich plasma, which is something I've been using in my practice for many years now, and it is a great alternative to some of the options that are provided by your conventional medical doctors if you're looking for something else. So it's an alternative to steroid injections. So some of you may have heard of platelet rich plasma. What is platelet rich plasma, or PRP? For those of you who have not heard of this term, I want to take a moment to explain this concept. So PRP stands for platelet rich plasma. Now, plasma being element of our blood. So just a quick review, this is a diagram of our blood. Inside our blood, we have different formed elements or cells. So we've got the red blood cells here. We've got the white blood cells and their different configurations. And then we have these small fragments, the smallest elements in the blood, which are platelets. Now, the platelets are super important because they're involved in wound healing and blood clotting. They also contain growth factors. So in order to turn whole blood into PRP, all we have to do is concentrate it. PRP basically just means that the blood has a higher concentration of platelets than normal. And we usually do this through a centrifugation process. So we basically just draw your blood, put it in some tubes, it goes into a centrifuge, and based on the density of the particles, you'll get the red cells will all settle down, and then eventually we'll be able to take this middle layer of the blood, which contains all of your platelets, and that's what we use to inject to treat your problem area. So that's what PRP is and how we obtain it. Now, this is a contrast to steroid injections, which is a medication that's commonly used for arthritis or musculoskeletal injuries. And how do those steroid injections work? Now, I know there's a lot of text on this slide, but basically what's going on is that steroids are a medication that reduce inflammation by suppressing the immune system and reducing the activity of the white blood cells and other inflammatory cells. So in that process, they kind of shut everything down. I like to use the analogy of like a computer that's maybe glitching out. If you turn it off and then turn it back on again, presumably when it comes back on, it's going to be working in more of a normal functional state. However, what these drugs do not do is address any of the underlying issues that contribute to the inflammation, pain, or the problem. They don't address the underlying cause of why you're in pain in the first place. They kind of just shut it off and then just rely on time and on your body to kind of do the rest in the meantime. So in the short term, they can be really, really helpful when we're having an acute injury or if we have some kind of inflammation that's gone out of control. But they're not always the best long-term solution. And that's kind of reflected in this study. I just wanted to highlight there's been a lot of research around the role of steroids in treating things like knee arthritis in this example. So this is a study where they looked at using triamcinolone, which is a commonly prescribed steroid injection, to saline. So basically a placebo, just salt water, injected into knees of folks who had arthritis. And this was a big study done at Tufts Medical Center. This was published in JAMA in 2017, 140-ish participants. And basically they treated once every 12 weeks for up to 2 years. And the effect was really, really interesting because the rate of cartilage loss, basically that marker of advancement of arthritis, the loss of cartilage was greater in the steroid group than in the saltwater group, which, I've kind of come to expect based on my understanding of steroids, but that would be maybe okay if there was an improvement in pain. However, in this study, the decrease in pain in this treatment group, the group who got steroids, was not significantly different to the group that got the placebo. So we're basically accelerating the cartilage loss for not really having any gain in terms of pain or function. So not a great trade-off. One of the reasons why I think that finding made sense is that steroids are known to reduce the production of collagen and in many cases slow down the long-term outcome of wound healing. So steroids reduce the activity of fibroblast cells, which are pictured here. These are the cells in our body that are responsible for maintaining protein in the extracellular matrix or in our ligaments or tendons, the main protein being collagen. And then less collagen production will have a negative impact for the rate of wound healing and also for once the wound is healed, how functional is it? What's the strength of that tissue? How well does it stretch? All of these things are impacted by a decrease in collagen. So in order to really talk about how PRP works, just wanted to go over some diagrams here about the wound healing cascade. Now, this is a naturally occurring process. It happens in our bodies all the time. And this is how we fix stuff when we have an injury or a cut or a strain or a sprain. So this is a diagram of the phases of wound healing. As you can see, they overlap, so it's not separate stages, but it's kind of a continuum across time. This first purple bar represents platelets. So you have a lot of platelet activity in the first phase of this injury. This kind of brownish bar looks at the fibroblasts, which are those cells I talked about that make collagen. And then this dotted line here is the level of collagen over time. So you see that as the wound repairs, the level of collagen goes up, and that corresponds with growing new fascia, growing thicker ligaments, growing thicker tendons, all of those things as we repair. And you see that this happens in distinct phases, okay? So we have our inflammation phase up first, and everybody who's sprained an ankle knows what that's like. You roll the ankle, that night you go home, it's hot, it's red, it's swollen. That's the inflammatory phase, and it's the first and essential phase of the wound healing cascade. The stuff that happens during that inflammation phase then triggers proliferation referring to the increase in cells, increase in activity. You're basically laying down the foundation for new tissue repair, and then over time that new tissue becomes mature, becomes strong, and that's the remodeling phase. Now, in time, this can take anywhere from 8 weeks up to 2 years. That remodeling phase, in some cases, we see the tissue gets stronger and stronger over a long period of time. So that's just our wound healing cascade. This is what happens naturally, as I said. Here's another diagram that I really like because it takes that previous diagram and puts it into the phases with basically just a schematic of what's going on in the tissue. So this is a cross-sectional view of a cutaneous injury, so like a skin injury, a cut. And this is a good model because this is kind of an example for many different types of wound healing. But first up, you have this big red cut cutting down through the skin. And then in the inflammatory phase, or phase 1, you've got all these chemical signals coming out of that cut. Okay, you've got things like VEGF, vascular endothelial growth factor, fibroblast growth factor. They all have different functions here, but you can see each of these letters corresponds with a type of growth factor that's involved in that phase. And then in the tissue, you see we've got down here the blood vessels, which VEGF is going to increase our vascularization or blood flow. You've got our stem cells in green, our fibroblasts in yellow, and our neutrophils and macrophages are these white blood cells there in the inflammatory phase. So that's the inflammatory phase there, and I just wanted to highlight that we think about inflammation as being a villain often. We think about how it's involved in so many disease processes, and but I need to point out that inflammation is not always bad, and in some cases it's essential. In the event of wound healing, if we don't have this inflammation phase happening, or if it gets interrupted prematurely, we don't cleanly progress into the later steps of the wound healing cascade. So you can end up with chronic inflammation or end up with a chronic injury where it just never really completely heals. So that happens often when someone gets an injury and then it's suppressed, like with medications early on. Like I always think of that old movie Friday Night Lights, where the guy busts his knee and he goes in the training room and the trainer wants to inject steroids into his knee so he can get back on the field and play that night for the big game. The steroids, yeah, they would help him not feel the pain on the day of that night, but in the long term, it's not helping his knee heal. It's not helping his long-term outcomes. So as we transition from this inflammation into the proliferation stage, you see this slide's a lot busier. There's a lot more stuff going on here. All of these growth factors, all of these things are signaling the different types of cells. We have a recruitment of new fibroblasts, and more of these orange cells are there. They're growing more collagen, and that's reflected by these gray squiggles of those immature collagen fibers that the fibroblasts are laying down as this wound heals. We've got our green cells are those mesenchymal stem cells, which have been recruited or directed to this area by all these growth factors, and they are helping to kind of regulate and modulate the healing that's going on here. We've got our white blood cells, the macrophages and the neutrophils. The neutrophils are up in the top of the wound helping with antimicrobial activity, and the macrophages are floating around everywhere, both phagocytizing or basically gobbling up either microbes or cellular debris or any of the waste products that are present in this process. The macrophages are cleaning that up. Okay, so all of this is happening in the proliferative phase, and actually you see the red lines here represent increased blood flow to bring nutrients and oxygen to the area to feed this whole process. So all of that is modulated by these growth factors during the proliferative phase. And then over time, these squiggly, kind of loosely knit collagen fibers are going to become stabilized, mature collagen fibers, and that's reflected by this kind of weave pattern in there as that collagen kind of binds together the wound, and you still have fibroblast activity in the area kind of overseeing that process, and this can take a long time, and you instinctively know this anytime you've gotten a cut, you've got a scab, and they tell you don't pick the scab, the wound's going to open up again. You leave it alone, give it several weeks after the injury, and that wound closes up. It's like it was never there. That's the process of turning this weak, immature collagen into mature, stable collagen. So this happens in a cut. This happens if you have a ligament tear, if you have a tendon strain. All of those things happen in that case. So just to overview that, PRP, how does PRP work during these phases? Well, PRP contains cytokines that are involved in recruitment of that initial inflammatory phase, or controlling the inflammation during that phase. During the proliferative phase, PRP contains growth factors like platelet-derived growth factor, vascular endothelial growth factor, transforming growth factor beta. All of those letters that you saw on the previous slide, PRP's got those growth factors in the platelets. So they can promote angiogenesis, promote cell proliferation. And then during the remodeling phase, transforming growth factor beta helps promote the formation of collagen and extracellular matrix, so it's going to help strengthen the repaired tissue. So PRP works during all three phases of that cascade to actually help fix the underlying tissue damage. Okay, this is just an overview of the growth factors that are present in PRP. So basically everything you saw on that previous picture slide with the cell diagram, all of those growth factors are there present in the PRP, and when we inject the PRP, those platelets activate and release these growth factors into that environment. Stem cell migration. I did want to talk about this for a moment because in that previous diagram you saw the green mesenchymal stem cells which moved into the injury area during that proliferative phase. PRP does influence that stem cell migration. Stem cells are unspecialized cells that have a variety of functions including tissue repair and regeneration, and then these growth factors that the platelets release stimulate the stem cells to move from other parts of the body into the location of the injury so that they can improve the rate of proliferation, increase the potential for tissue repair. Now, who is PRP for? Who would benefit from a PRP injection? And there's a wide range of people who would benefit from this. So anyone who's looking for a non-surgical option to address pain or dysfunction, anybody who's looking for potentially a drug-free option, they're trying to avoid using any pharmaceuticals, if they're trying to reduce the use of ibuprofen or other NSAID drugs, or maybe they've already tried a steroid injection in the past, maybe didn't have the greatest outcome, want to try an alternative to that. If you're looking for a supportive therapy to help rehabilitate a chronic injury, PRP is a great tool to use. I've treated many patients who say, you know, when I was in high school, I had an old football injury and now I'm 50 and it's starting to bug me again. That's a great option to use PRP to try to help encourage repair of that tissue. And then also I want to talk about this concept of prehab as opposed to rehab. Now, this concept of prehab versus rehab, what do I mean by that? Prehab, we're talking about taking a proactive approach, preventing injury, preparing for surgery through targeted exercises, conditioning, and just making sure that your body is in a state that, you know, it can handle what's to come. So a person's physical fitness, strength, flexibility, balance before an injury or surgery occurs is going to improve their outcomes afterwards, going to improve their recovery, going to improve their healing afterwards. And this could also include, beyond just physical conditioning, also things like diet, making sure that their nutritional status is good, make sure the quality of their sleep is giving them enough rest to manage the tissue repair. So all of those things factor into a prehab program. On the other hand, rehab is the traditional approach, meaning you have a surgery and then you go to physical therapy afterwards, and then you try to regain that function after the loss of function. So you're going to try to be improving the range of motion, the strength, flexibility, using the exercises and therapeutic interventions after something has occurred. So the prehab approach, more proactive and potentially has the ability to get you a better outcome in the long run, maybe recover quicker, heal more completely. So how does PRP fit into a prehab routine? There's a couple of ways that you can implement PRP into this kind of a protocol. One, you can use it as a complement to targeted exercises, and this is something I do very, very frequently. Unfortunately, and timing-wise, we often get a patient coming into the office after they're injured, and then they want this kind of treatment. So I commonly use PRP injections in conjunction with things like physical therapy to help improve the rate of recovery. But you can also use them ahead of time to improve strength and flexibility in areas that need some attention. So like, for example, if you have a weak rotator cuff, perhaps PRP injections into those rotator cuff muscles in the shoulder can help to get you better function. Or if you have bad hip mobility, for example, you're going through some training and realize that you're not able to move the weights that you expect because your hips get locked up, PRP injections may help to improve that mobility as well. In a preventive measure, so if you know that you're at higher risk of having an injury, maybe it runs in your family, you have a family history of knee osteoarthritis, PRP injections may be a way to work as kind of a preventive maintenance or reduce the risk of you progressing to have that condition in the future. And then as a preparatory measure for surgery, by injecting PRP adjacent to where you may be having a surgery, you can kind of prime that tissue to be more, to be able to have that complete wound healing response after your surgery and potentially heal more quickly. Okay, so those are a couple ways that PRP may roll into a prehab routine. Now I'd like to share with you a couple of cases from my clinic of patients who have responded to PRP treatments. Tell you a little bit about their stories. First up is Maria, a 60-year-old female, name and age changed to protect patient privacy, but this is her story. She'd been having pain in her left shoulder for about 5 months. The pain had progressed from just a nagging kind of background pain to intense, up to 8 out of 10 sometimes, and to the point where at night, if she rolled over onto that left shoulder while she was sleeping, it would wake her up from sleep. So impacting her sleep quality, which had a downstream effect on other chronic health conditions that she was working on. She couldn't reach up overhead, couldn't reach out forward without provoking the shoulder pain. So as you can imagine, it really had an impact on her activities of daily living, doing things around the house like cleaning up, doing laundry, cooking, food prep, all that stuff provoked pain for her. And she went to her orthopedic specialist who did an MRI and revealed there's a lot of stuff going on in that shoulder. Arthritis of the acromioclavicular joint, tendinitis of the biceps tendon, there was a tear of her labrum, and then there was a partial tear of the subscapularis. So at least 4 different places in that shoulder that needed some attention. And because of the complexity of that injury, the orthopedist was thinking joint replacement. However, at 60 years old and with this level of function that she had, Maria didn't feel like it was the right time to do shoulder surgery. She wanted to seek some alternative options. So she came into me, we looked over the imaging, we did an exam, and decided to do PRP injections to address all of these things that were found on the MRI. So she came in for those PRP injections. We did about 5 different injections to address each of those locations that were found on the MRI and that corresponded with her deficits in function. 2 months later, we followed up, and Maria had a 90% reduction in her pain and almost complete resolution as far as function and range of motion. So she was able to reach up overhead, she was able to reach out to the side, able to reach back without pain. Occasionally, if she was very active and kind of pushed it a little too much during in any particular day, she'd get a little 1 out of 10 soreness. She also was able to completely lay on her left side in bed without provocation of pain, so the pain wasn't affecting her sleep anymore, and she was seeing an uplift in many other aspects of her life because of her improved sleep quality. So overall, big win here. We decided Maria wanted to get that 100% resolution, so I said we can try to do another round of PRP injections. So we did that. The goal is for her to get to 100%. We're about 3 or 4 weeks out from another follow-up visit, so we'll see how she's doing there shortly. Next study here, this is Brian, 40-year-old male. Again, name and age changed to protect patient privacy. And this is not a chronic issue like what Maria had, but more of an acute issue. He was at work, he stepped up onto a high ledge and felt a pop sensation in his right leg. He was shocked. It was a very rapid, very violent kind of pop sensation. He thought he'd been shot, so he looked down at his leg looking for blood or anything. Turns out he had an injury to his calf muscle on that right leg. He came into the office, he had a boot style brace that he had at home. He put that on because he felt that every time he pushed off through the bottom of his foot with weight, it provoked his pain. The pain was like a 5 out of 10 intensity and it was cramping. He felt like it was a very tight knot in that muscle. We examined him and determined that this was a strain of the right calf. We did some imaging, make sure there wasn't any complete tears of the Achilles or anything like that. but this was definitely a muscle strain injury suspected to the area of the muscle where the Achilles tendon attaches at the top of the Achilles and the bottom of the calf muscle. So we decided to treat with PRP injections. We used ultrasound guidance to inject near the musculotendinous junction of the Achilles tendon, and we were able to also locate that through palpation. We were able to feel along that muscle and found one spot in particular that was very, very tender. So we injected PRP into that area. At 1 month after the PRP injection, Brian reported about a 70% reduction in pain. He was able to return mostly to his work functions. He did have to back off a little bit, not work at 100%, but he was able to do almost everything, and he had regained his full range of motion. So previously, he wasn't able to push through the bottom of his foot when he was walking, pushing off. That improved. He also wasn't able to stretch as far as flexing the ankle because that pulling sensation in the back of the calf was painful. At 1 month out, that restriction was almost gone. At 2 months out, we did another PRP injection at 1 month. At 2 months out, after 2 rounds of PRP injections, Brian reported almost full function. He went to the Grand Canyon with his family, hiked several miles with no pain. So that felt really great. He was really optimistic about that. He did want to do another round of PRP injection there just to be completely thorough. He did a 3rd round. And then we did follow up at 5 months post-injury. Patient reported that he was out in the woods with his family. His kids were in a 4-wheeler and they crashed. So he heard about that, took off running down the trail, almost a full sprint down an uneven trail in the woods to check on his kids. Fortunately, they were fine. No one was injured. But afterwards, he realized that he had no pain in his calf on a full tilt sprint down the trail. And then the next day and that evening to the next day, he did not feel any soreness in the calf either. So this reflected that he had pretty much a complete resolution of that injury to the calf, and he was able to exert himself fully without any problems. So very great response here. So to wrap things up, in conclusion, we talked about PRP is a natural alternative to steroid injections, and it's indicated to give you relief from pain for musculoskeletal injuries, whether that's from an acute or chronic injury. PRP can work to help heal those injuries. We learned how PRP works by interacting with the natural healing processes that happen in our body and by increasing the potential for tissue repair. That's in contrast to what the steroid injections do, which is to block and suppress inflammation, which sometimes can lead to incomplete healing. PRP upregulates that process to lead to faster and more effective healing. And we talked about how PRP can be useful for a wide range of conditions and for people with different goals. If you would like to talk to us about how PRP might be able to help you, if you've got a nagging chronic injury or you just want to learn more, please give us a call. You can schedule a consult or you can visit us at eastvalleynd.com. Thank you.